is, if you've had vaccines as children, do you need boosters now? It depends. So, for anyone who's had the real disease, for example, chickenpox, measles, mumps, whatever it is highly likely that you have lifelong immunity, because there's nothing so good for the body as, having had that disease back then. However, when I was little, we didn't really have all of these vaccines, and certainly they weren't available to me where I came from, so I ended up having all those diseases as a child. However, my kids are 1,000% fully vaccinated because there's no way I want any one of them to develop measles. Certainly my daughter is within childbearing age. No one yet, so I hope she's not really childbearing, but she's in that age. So I want to make absolute sure that she's going to be up to date with her chickenpox, because she could die, the baby can die, it's a disaster. So absolutely. So it depends what vaccines. Some need boosters, some do not. If there's any questions, there's some very, very easy blood tests that doctors can do. They're not that expensive, and you could see if you need a booster for some of the hepatitis vaccines or not. And actually, so thank you for bringing that in, because again, I don't mean for you to sit and read all the little parts of this, but all of us doctors, we all have these tables in our offices. These are for adults. These are the latest immunization schedules. And up here starts with influenza. And I hope absolutely everyone in this room has gotten or will be getting the flu vaccine. The flu injection, the vaccine that you give as a shot, is dead virus. It cannot give you any infection. It is not possible. It is 100% dead. What you will get is your body's reaction while it's making antibodies to the vaccine. So what will you feel? You will have soreness at the site, because that's your body reacting to the vaccine, which you want. You will have tenderness. You might get a little sort of achy, maybe even have a low-grade temperature. That is your body revving up, making antibodies to the vaccine you got, which is a good thing. It's saying that the vaccine is doing what it should be doing, which is causing your body to make that defense mechanism to influenza. You cannot get the flu. Many of my patients say, I got the vaccine, next day I had the sniffles. Okay, you had the sniffles because the rest of your family had the sniffles the whole week. You just got the vaccine while you're sort of incubating this infection. So absolutely everybody should get the flu vaccine. There's no reason not to get it. Even egg allergies are not enough nowadays to prevent you from getting a flu vaccine, unless, again, if you have anaphylaxis to eggs. Clearly you would know it, because there's many foods that you cannot eat, because eggs are almost in everything, so you have to be careful about that.
I actually have a question. There are some pediatricians now who insist that grandparents, as well as parents of all newborns, get Tdap because they don't want the children to get pertussis.
That's right.
And there are reasons for that.
Yes.
And there are reasons not for that. And I have noticed that I see a lot of grandparents, some of them come in to get Tdap, and
yes.
some of them don't get it. I'd like to know what your opinion is, because everybody here is a grandparent or is about to become one.
So without a doubt, the rule for pregnant women is that they have to have Tdap during pregnancy, with each and every pregnancy. So if a woman is pregnant, let's say, I'm being very dramatic, every 9 months she is pregnant, she's going to be given the pertussis vaccine each and every time, because it is a deadly infection for a newborn. So it's the kind of thing where you cannot get the vaccine enough, because it is devastating for children to have pertussis.
The question is grandparents, though.
Yeah, no, that's my point. I was being dramatic, saying if they do that with a pregnant woman, and you don't give a pregnant woman anything, right? Then everyone else should absolutely get the pertussis vaccine. And also, by the way, tetanus as well, right? Because many of you probably may not remember the last time you had tetanus vaccine, and you may be at risk for falls, and maybe you put your hand out to stop your fall, and you jab yourself with something in the backyard or on a staircase in the street, so now you're at risk for tetanus. So all of us have to be super careful to make sure that we're up to date with all of these vaccinations.
So this pertussis vaccine, how frequently is the grandparent or great-grandparent supposed to get this vaccine?
So I never talk off the top of my head because all of these things are in here. And you get a TD booster every 10 years. You can certainly get Tdap if you've never gotten it. And what I don't have here for you is there's 2 pages of explanations and footnotes. And we all have these in our office, so when we have patients who ask us about this, we go to the table, we go to the years, then we go to the footnotes and make sure that we're doing the right thing for everybody.
What's zoster?
So zoster is when you get chickenpox later in life. And that you can give a vaccine to people so that chickenpox does not come back later in life. Yeah.
A question from the
Yes.
audience, and I'll append something to this.
And I think that is
If a 50-year-old adult never had chickenpox, should he or she have a vaccine who never had the vaccine? And I'm going to just